So I have the job title of an Allied Health Professions Professional Lead for Shropshire Community Trust. What does that mean? I could give you the stock answer of I provide professional leadership for the 7 AHP professions that we employ. But again, what does that really mean? I do an awful lot of listening, probably lots of coaching type conversations to support our AHPs to find the answers for themselves. Mostly at the moment I talk to a laptop. So I've been working from home a lot since the start of COVID. For the past 2 years, I have chaired the AHP faculty in Shropshire, Telford and Wrekin. So that is a network of AHP leads who work for different NHS organisations, the local authorities, the universities, and now starting to involve our primary care colleagues, looking at all things workforce related for our AHPs. And that's been an amazing opportunity to meet people that I wouldn't normally come across, and to really see relationships grow and the network of AHPs across Shropshire, Telford and Wrekin really develop. So I was very fortunate to be probably in the right place at the right time to take that on, and it's been an absolute privilege and a very steep learning curve.
And as an AHP, you trained as
Yes.
in a profession, didn't you?
Oh,
as
yes.
an AHP?
I am
So
actually a physio by clinical
Yeah.
background. So I kind of forget that bit. So yes, I graduated from Keele, so not too far from here. I actually did clinical placements in SAF and the Robert Jones when I was a student. So yes, I am originally from the southeast of England, so went back home, back to the home of mum and dad for a little bit when I first qualified. I ultimately specialised as a neurocritical care physio, so I was very lucky to get what I still think of as my dream job, or my dream job at the time.
That's
to be
amazing.
the lead physio for a major trauma centre working in their neurosciences centre down in Brighton. And then life took a bit of a turn and we moved up to Shropshire.
And that's really interesting because I don't think any of us are from Shropshire originally, because you moved
around a bit.
Yeah.
So
tell us a bit about
where
you.
Where have I been? So I went to Newcastle upon Tyne University. It wasn't called that then; it was just called the University of Newcastle, I think. I did a 4-year BSc in speech and language. So I'd spent like the first year of my life doing anatomy and physiology with the dentist. We were in the DR together, so in the dissecting room together. So my textbook of anatomy was anatomy for students of dentistry. So I felt really, and most of my friends were dentists from Newcastle. So I liked it.
It's interesting how you've moved into leadership though, and management, and then you sort of moved into AHP leadership as well.
Yeah, that was really, really strange. I think we fought very hard coming from children's services, didn't we? We fought very hard for there to be a children's AHP lead because we just had that history of togetherness in children's services, children's AHP leadership. What that means, I genuinely don't know. But I think in my role, I've got a performance and management hat on, and then all the time also a professional hat on, and I personally like that. I like the idea of having both in the same role, but I appreciate that not everybody thinks it's a good idea, because you have to have like is this a quality conversation, is this a performance conversation, contractual conversation, don't you? And that's within me, not just, whereas in other bits of the trust it's in 2 different people, isn't it now?
Yeah.
But I do like it. I think it works well in a small team like children's AHPs. But it's the role that I project most when I'm outside of the organisation. I don't know if you're the same, but I tend to say I'm the children's AHP lead because people don't really know what clinical services manager does. For example, with education colleagues or with social care colleagues, they get that you're there representing a group of professions. I think it's the term that I use the most outside. Do you?
I definitely do as well.
And I think I do the same. So as an occupational therapist by background, I always would say I'm an AHP and an occupational therapist. And, you know, kind of that's become something that I think is really important in terms of the organisation and just raising the profile of what AHPs do within the organisation, because there are the 7 different professions within Shropshire Community Health Trust, and it's, you know, kind of people sometimes know what we do but don't always, so it's always important, I think, to say where you've come from.
Yeah. So where did you come from?
So I trained quite late. I came into the NHS in my 30s, so I trained as a painter previously and done a lot of community work with children. Children have always been kind of in the picture. And I did a different route in. I did what was then the postgraduate diploma into occupational therapy. That doesn't really exist, but you can do another route. You can do your master's, or you can do a second degree if you want to, or there are lots of different routes into the profession now, apprenticeships, and locally we're supporting all of those different routes. So I came that way, but then I went straight into community service almost, and loved community working, and that was my first love. I loved the challenge, the variation, and being out and about with families, but different scenarios every day. And I think that's a really common theme about people who work in community services, liking that variation.
Definitely.
So then moved to Shropshire. Was really lucky to get a job here as I moved over, and have stayed here since.
I completely agree. I think, particularly if you're interested in function over clinical difficulty or strength, if you're interested in function, then the community just has function built into it, doesn't it? You don't have to generate a function. You don't need a fake kitchen. You've got real kitchens. You don't need a fake classroom. You've got a real classroom. Sorry, maybe the word fake is a bit much, but you know what I mean. Yeah. I think that's had such a strong focus, hasn't it, over the last couple of years, particularly across AHPs, isn't it? So you've got a context in which to do that more successfully, possibly, than uni professionally.
And as a collective group of professions, we're definitely stronger together, recognising that we're all unique. But I think my role, particularly within faculty, has really shown me how much we can learn from each other, how much similarity there is, but how unique we all are in our different professions, which has its challenges, but it's also, it adds to that. Every day is different. Every day gives you a different challenge to overcome, which does make leading AHPs really interesting and rewarding.
Yeah, you meet all sorts, don't you? Both in terms of the people who you work with, the staff groups, but also people who might want to be one of you. The numbers of people who in schools say to me, how did you get to do it? Have you got any assistant jobs? Because they're working with us, aren't they, on a day-by-day basis on the same things, and they get really into it and want to consider it as a career. And just from those first conversations, I love that moment when they say, have you got any jobs going? It's like, well, not at the moment, but, you know, these are the routes, and it would be, it's a real delight to know that they value the career that you're doing and the work and the value that you add to the work that they're doing with the kids, isn't it? I think, and that they see themselves as potentially being good at it and would like to continue. It's great.
I almost wish when I was making my A-level choices, so I went through a very traditional undergraduate route, I wish I'd known then the diversity of professions that I know about now.
Oh, what would you have been?
I think I'd have still been a physio, but I might have dabbled in radiography and thought about it, but
you'd have been in high demand if you'd done that.
I would have been in very high demand, particularly as a diagnostic radiographer.
Yes.
But I think for me, I didn't know that physio in the community existed. Definitely didn't know respiratory physio existed. I actually wanted to be an animal physio, which is why I went into physio and have actually never left people, because it was so rewarding. But just knowing that there's more than what you see on TV, that we're all completely intertwined, and that we all bring something different to support the individual or the community or the education of a young person, not me personally, that we all bring something different that enables a person to live their best life. And that if you take one of us away, there's a gap. And maybe you wouldn't think that there would be a gap, but there really is. And I think that's what makes us such an amazing group of professions, that we have such amazing similarities. I like to say we're all problem solvers by profession. It's something I very much talk about when I've got students with me, but we all bring something so very unique that enables a person, a child or an adult, to go on and live their best life. I think that's such a privilege to be able to do that.
And I think particularly in children's, we work in teams, so we do work with other professionals as well as other AHPs, but that team working is quite a strong bond. So I think in terms of it being a very rewarding role, that also comes from that team working. In adults, I know that we've got AHPs who do work, who are very autonomous and don't work in teams, and they get an immense amount of job satisfaction from that. But we've also got really strong teams. So you could be, there's something to suit everybody. You could be autonomous, or you could be working in a team, and you can find the best to suit you. But it's about finding that out, isn't it? At the early stages of your career, sort of finding out how do I become a podiatrist, or how do I become a physiotherapist? You kind of, and I think talking to us or coming and finding out about work experience with us, those are all really good ways of
definitely
getting into the sort of know what the diversity is like within the career pathways.
So between myself and my colleague, I think I added it up, and we've taken 13 leadership students during COVID. So I guess we run the placements a little bit differently. Mine tend to be completely virtual for a variety of reasons. But to show, hopefully, and they've all been physio students to date, but we are trying to expand and show that maybe we don't need to provide leadership placements for just our own professional background, that leadership is leadership. But it's been it's been eye-opening. It's had its challenges, but mostly it's been so rewarding to get back engaged with students. And a lot of the feedback that we have is that they don't feel that they learn what makes an NHS organisation run at university. And if I reflect back on my own undergraduate training, there probably just wasn't time. But I've exposed students to meetings within the organisation, to meetings across the integrated care system, to meetings across the Midlands, but also to national level meetings, and kind of just come with me and been thrown in. But part of what I'm really proud of the students we've had is the legacy they've left behind them. So 2 of our students have written content for our ICS-wide preceptorship programme that will live on, and it's written from their perspective, and they are the intended audience. And it was just amazing watching them grow as leaders and actually having some really courageous conversations.
Have you had your students clinically or in your leadership roles?
We have occupational therapy students, and they come clinically, and they will work in the team in the different clinical areas. But we've also been sort of looking at student placements across all of the different professions, so trying to promote and increase the number of student placements we've got within the organisation. So and that this year we've seen more students come in on placement this year, which has been really, really rewarding. And I think you get such a lot back from having a student. You get asked questions, they make you think about what you're doing and how you explain it, and kind of review your practice, your clinical practice, but also bring in new knowledge that you can really use and implement in your own practice.
So many of them, the courses all have a component of project work in them now, don't they? So they've all left a legacy of either some research that they've reviewed for us, or some practice that they've quality assured, or there's some really great stuff going on, isn't there? Sorry, you were saying something
And
else.
I was thinking about support. So you mentioned preceptorship, which is there to support people who are newly qualified into role, and I suppose for people who might be coming different routes into, say, returning to practice or perhaps international recruitment, that preceptorship is there. But I think the other thing that we've been focusing on as leaders is putting more support in for people. So in the last year or so, sort of growing professional forums, looking at forums for staff who are newly qualified to talk to leaders within the organisation and raise concerns, but also to gain sort of support for themselves as kind of forming a new network. So those networks, I think, are getting stronger within the community trust, and I think people are really seeing the benefit of those.
Yeah.
So that's, I think, been an important development since COVID, because we lost a lot of support during COVID.
We've got staff working
Out of Edinburgh and London, remotely, which wouldn't have happened. But then there's all the work that we learned from Kate, because you did loads and loads of support of our current staff when they were on redeployment, didn't you? The OTs and physios and the speechies who were out doing in different places. The different team leads took on a different neighbourhood, and you learnt so much, didn't you, from going out and watching people arrive in new environments and the support that people needed.
Yeah, and I think that's one of the nicer sort of things, the things that I enjoy most about leadership is enabling people and supporting people. So even when it's a new situation or there's a change, or it could be a change in the service or a change in service delivery, or, you know, kind of a redeployment, but it is, I suppose, it's most rewarding to be able to go and do that work and see other people achieving what they need to achieve in their environments. Yeah.
And we're doing a lot of work now, aren't we, with support staff, so people who are who have possibly been quite stuck in their roles over many years, and looking at other ways that they might develop their careers. And we're trying not to make it so that the next generation's career is a model of ours, isn't it? We're trying to look at different ways for people to move through their careers. And that is completely new, and I think it has come from AHPs working together more to see you can do things in different ways.
I'm really excited about the growth of apprenticeships and just the opportunities that those give for as far as you want to take your career. So really supporting our support workers who want to maybe train into one of our professions, and we have more professions across the integrated care system, but that almost reflecting on my own experience of, I wonder what it would have been like to be a radiographer, that kind of try before you buy, but the earning while you're learning, I think particularly with the current cost of living,
in comparison to student debt,
is that just a different way of getting a different experience, but still coming to one of our professions with the same qualification, the same career opportunities, but just done through a different route, and working whilst you're learning, just the opportunities that brings.
And with our apprenticeships at the moment, apprentices who we've got who are employed by Shropshire Community Health Trust, we've got people who are able to almost rotate their placements within Shropshire, so they can have a placement in Shropshire Community Trust, they could go and have a placement over in Robert Jones and Agnes Hunt, or the Shrewsbury and Telford Hospital Trust, so they could move. So that's an opportunity, and a bit like we've got the Band 5 rotations happening as well. So there are definitely opportunities if you live within Shropshire to move between more organisations and providers, but also be supported by our organisation if you work for us. So I think that's been quite a new development.
One of the things that I think the next big thing for us is going to be about research as well, isn't it? And the focus on evidence-based practice and about what the research is saying. And I think, again, with AHPs working together much more closely, there's just the funding opportunities for research. Just ways into research as a career, but also ways into actually getting some research going in the community, because we've not really been a hotbed of research, have we? So I think that will be really fabulous. And we've got 2 speech and language therapists, one doing a PhD at the moment about fluency, and the other doing pre-doctoral research around the relationship between communication and the outdoors. So really one of those people who loves the outdoors. So that will be really fascinating to see that. And her some of her mentorships are coming from all over the world. Like she's got people interested from all over the place. Got people who are interested in advanced practice.
And doing their advanced practice. So
that's good.
Yeah, and that's that's another opportunity, and we can support that, can't we? We can kind of the flexibility, I think, of our job roles enable people to have that additional CPD time and move around it a little bit. So that's another positive.
I completely agree. In the community, particularly in children's, you can flex your weeks so differently, can't you, to maybe a more kind of routined, rotated type of profession. So I think we are so fortunate that in children's services there are bits of the day that are less useful for families or schools than other bits of the day. So it is quite flexible in children's in particular, isn't it? You'll have to be more creative probably in adult services.
I know that Shropshire Community Health is really looking at, it's called flexible working, but how do we then support that wherever you work to have a job that fits around the needs of the service, but also around your individual needs.
You can move around, you can change, and you can also work together. So I suppose with our SEND roles, so you can work together on different, I suppose, development work at the kind of more senior level. Some of our clinicians will work collaboratively to take initiatives forward.
Things that grow from multi-professional working, and particularly if sort of multi-generational working as well. So the children are involved in some of the ideas, and the families are, and the staff are, and there's different ages and experiences of staff. I love that kind of stuff, where it doesn't feel like it's owned by a clinician with a good idea. It's just owned more as a community and collective. I think that is so exciting, because when you talk to children about what they'd like to see, it wouldn't be this physio room probably with the grey walls, but it probably wouldn't be the corridor with the crazy painting. But although the children did choose the crazy painting. I think all of these things around how you engage different parts of the system to get the best, that's really important, isn't it? And honestly, that it's the same when you work with the elderly, isn't it? You just get such joy from the things that they tell you about what appeals.
You absolutely do, and I always think I wasn't maybe the biggest fan of working in the community when I first graduated. I'd never done a placement in the community, so again, just having the opportunity to see how people really live. And it's fascinating.
You do feel privileged to be allowed into people's homes, don't you?
And as you were saying earlier, it makes it very real. What matters to that person. And I've come up with some crazy plans, but they've worked and put the person back in control of their situation. So I think the community gives you such a different insight into healthcare. And I think being now in a leadership role, I don't know if you've found the same, I've definitely developed a network both within Shropshire Community Health Trust but outside of it, so that you can start to see opportunities for joint working, maybe roles that sit along and support a patient's pathway rather than an organisation, but also learning from each other, pinch with pride.
Yeah, definitely. And I think that's really important in terms of AHP leadership. I see that as where we would be heading, is to improve those pathways across Shropshire and Telford and Wrekin, and working towards putting those pathways, making them smoother and seamless for people, so you can be naught and go to 90 without having to negotiate lots of different services.
I think we do know that in children's that we're lucky, because there is more, there are more kind of cohesive teams.
And what would you think our advice would be to anybody coming into leadership roles? What would we're thinking about pieces of advice, career advice, what could we say?
Find your tribe.
Find your tribe.
I would definitely say a network is important, but it may not be the network that you used to have. It's definitely something I've learned. So yeah, and be brave.
Be brave, definitely. Yeah.
Yes.
And look for support, knowing where you can get support from, because I think that's really important. It might be different support, but I felt really well supported in the roles that I've been lucky to come into. So in the seconded role, the support that I've had from you, Alison, but Liz as well, but also other people within the organisation, and the people step forward to offer that support. You don't have to go and look for it. So
I think that's one of the
really
things that
valuable.
really comes out, doesn't it, from talking to the staff, that how people are willing to set aside what they had planned to help somebody else. Like, that is true. But I think we've just been really excited, haven't we, to see the opportunities, particularly, you know, you have to, in a place like Shropshire, you have to grasp the opportunities, don't you, because they don't come around very often. So I think that's really important, to look for opportunities, seek them out. And one of the things about networks is that if you've got a good network, you get more opportunities, don't you? You find those opportunities. Find your tribe.
Find your tribe, be brave, and don't be put off by the job description or the job title. I think as AHPs, we are definitely changing the mould of the NHS and beyond, and something that maybe has always been a role for a different profession suddenly is open to a much broader professional background, or non-clinical in some areas. So I have another role in a digital world that I wouldn't have known existed before I came to Shropshire. But again, it was an opportunity. I took it, and it's opened other doors for me. So I think
that's really significant, because that's another part of what we haven't really talked about so much, with the research on one side, but the innovation and the potential for innovation. And that comes through digital and technological innovation, doesn't it, as well as other patient engagement or parent engagement type innovation. But I think that's really significant that you're now embedded, aren't you, in that world?
Yeah, I think it's
a bit of analysis.
It's one of the huge common themes across all our professions. So we have a problem, let's find a solution. And I think as we've developed as leaders, our solutions are just, they may be broader or going off in a different direction, but it's almost no different to problem solving for a child or for a patient or a person. It's just changing the environment or the context of that problem solving.
I think I would say don't be afraid to make sure that you've got time for yourself as well. So the temptation is to go into a leadership role and put everything into it, and you quite quickly find that you can feel burnt out. So now I think people understand a lot more about people's well-being, and the need that needs to be part of your role, and you need to be able to show that within your own leadership role, so that you do take time for your own well-being, and that helps you as well as others, and it helps. So just to be really conscious of that when you're starting off in leadership. It's quite easy to get overwhelmed.
I agree.
And take on too many things.
I think you've got to industrially celebrate success and achievement.
I think being a good listener is learning from things that go wrong or have gone wrong, but also listening. So never forgetting to listen to the people that you're leading or who are part of your team. And that's really important.
And then the parent and the child voice, really hearing what people have got to say. So I think quite often we have a system response, don't we?
What difference do I make? I think it is about that focus on trying to open doors for other people, but also enabling things to happen. So my motivations would be about problem solving, but can we make something happen, whether it's clinical care or whether it's staff wellbeing or whether it's leadership or promotion of what we do as AHPs. So that would be hoping that I'd make a difference. And I suppose in children's services, kind of getting children's services recognised within the system that we work within.
Yeah, that'd be cool.
So small differences. What about you, Alison?
I think I genuinely believe that AHPs are very good at finding the gaps between different parts of systems and growing solutions for those gaps.
I want to ensure that we've got a workforce with the right skills that can be used at the right time in the right place to enable a person at whatever age they need us to be the person they want to be. And I think that's absolutely a reflection of the opportunities that I've had, particularly over the last couple of years, thinking very much about workforce. I think AHPs have got a lot of solutions to some of the challenges that we currently see in the NHS. And we're starting to be more heard. So I think it's a really exciting time to be an AHP of whatever professional background is right for you.